All right. Hey, welcome. We're doing a series of press conferences around the state focusing on COVID-19 and the vaccinations. I'm Bob Sanborn. I'm President and CEO of Children at Risk. We have a distinguished panel to talk to the press. With us is Allison Winnecke. She's the President and CEO of the Immunization Project. Good morning, Allison. Also with us is David McClendon. He's a principal and a researcher with January Advisors. Good morning, David. Also with us, Dr. Claire Bikini, and she's a pediatric infectious disease specialist over at Texas Children's Hospital. Dr. Bikini, welcome. Also with us, Dr. James McCarthy. He's the Chief Physician Executive with Memorial Hermann Health System. Dr. McCarthy, welcome. And then also with us is our good buddy, Colleen Dipple, who is the founder and CEO of Families Empowered. Welcome, Colleen. There are 29 million people in the state of Texas. 21 million of those are adults that are going to be in need of the coronavirus, the COVID-19 vaccination. So far in our state, 2 million doses have been distributed. Only 1 million people have been vaccinated in our state. What we know is that in Harris County, here in the Houston area, only 4% of our population over the age of 16 has received even one dose of the vaccine. That means 96% of the Houston area is currently unprotected. As we've seen lessons from the rollout, the current rollout, we know that Texas needs to get its act together. We need to have a less confusing system as we move forward. We know that there are moms and dads and lots of caregivers, a lot of first responders that and people who lack access to healthcare, who are confused about how to get vaccinated. We also know that many, because of the current immigration climate, because of poverty, there are many others that are hindered from getting this vaccination. We have to pay special attention also to our high-risk population, our historically hesitant populations, to ensure that we have equitable distribution. In Harris County alone, an estimated 37% of the population said that they were very likely to take the COVID vaccine, the COVID-19 vaccine. That means that there are still far too many, over 60% of the population, that's somewhat or very hesitant about getting this vaccine. Still far too many to really wipe out the coronavirus and to create herd immunity. We really need a better long-term plan. We know that there are these hesitant populations. We know that the African-American population is hesitant, though that has been changing over time. We know the Latino population, the new immigrant population, a lot of the suburban population is hesitant. But also there's a significant population in Texas without health insurance that has said that they are very hesitant about this vaccine. This to me is very worrisome, because we have the highest proportion in our state of those without health insurance. And if that very population is feeling like they're not sure about this vaccine, we're going to have to create a new message, a new plan for that population. We have to get our act together around this vaccination and around making sure that we can conquer COVID-19. We have to figure out who is hesitant exactly, and how do we overcome that hesitancy? We're going to have to do focus groups. We're going to have to do meetings with leaders. We're going to have to do surveys to figure out exactly some of these key things. We know that right now people are lining up and anxious to get this, but this is still a small portion of the population. This is a year-long plan that we're going to have to be engaged in. And there are populations that we're going to have to get in line. And it may not be until June or July that we're arguing and trying to figure out how do we get these people vaccinated, but we have to figure out those things right now. We need to develop individual and unique messages for individual and unique populations in our state. 4% out of 100% is not going to do, but neither is 37% out of 100% going to do. We're going to have to develop some statewide policies. We're going to have to be open to lots of ideas, to partnering with nonprofits and partnering with specialists and hospitals and others that have an expertise in this, so that the state does get its act together, so that we create policies that are effective, and that we make sure that we vaccinate and that we're equitable in that vaccination with everyone in the state of Texas. In the end, all of us as leaders in the nonprofit area, in the health field, we want to make sure that everyone gets vaccinated and that Texas is healthy and that our economy can return to its vibrant form. but there's work that has to be done. And we have to start working now on not only those that are in line, but those that are going to be in line months from now. Allison Weineke is the president and CEO of the Immunization Partnership. Allison, what do you have to say?
Well, an issue we have is that many Texans have lost trust in their public health officials and politicians. We've heard about a year of mixed messages from all levels of government. It's confused the public, damaged credibility, and allowed fear and misinformation to spread. But the COVID-19 vaccines we have are the best tool to end this pandemic and return to life. And let me be clear, getting a COVID-19 vaccine will save your life. The Pfizer and Moderna vaccines are about 95% effective after you receive both doses. And they're essentially 100% effective in preventing you from contracting a serious case of coronavirus. But this is the issue. American medical experts estimate we will need at least 70% of Texans vaccinated, but it could be up to 94% of Texans vaccinated against the coronavirus so that we can end the pandemic and return to our lives. But with these problems with trust, messaging, vaccine availability, distribution, and access, frankly, there's been a lot of passing the buck from federal to state to local. And unfortunately, it's our local communities that are paying the price. This is really why we need to rely on local partners like the Immunization Partnership and Children at Risk and our collaborators to fill those gaps. We need to assess communities with high COVID-19 community vulnerability indexes that include factors like social vulnerability and also high-risk populations for the disease. And our collaborative needs local foundations to step up and help support us craft the tailored messages to local residents who may be skeptical, they may be concerned about a vaccine, so that our messages can get them trusted, accurate information about how getting a COVID-19 vaccine will save their lives and protect their families. I'll just give as an example data that was just released today that Black Americans are being vaccinated at a significantly lower rate than white Americans. Sometimes it's 2 to 3 times less. And this is unacceptable, and we cannot allow this to happen in Texas. I implore our local leaders to step up and support this project, and also for the Texas legislature to pass legislation to build a more functional state immunization registry, reduce vaccine preventable disease spread in our congregate living facilities, increase vaccine access and equity, and support vaccine research and development. And every day, the Immunization Partnership with our partners are fighting for Texans to make sure that you have access to COVID-19 vaccines to protect yourself and your loved ones and end this pandemic.
Thank you, Allison, very much. Dr. David McClendon is with January Advisors, and he's a researcher, and he's going to share with us a couple of slides as we look at some of the research of what's going on with COVID. And David, you're on mute, so you might want to take yourself off mute, and let's look at these slides.
Thanks, Dr. Bob. So I just want to reiterate some of the data that Dr. Bob was talking about at the top, which is one, the headline that a recent poll, December poll by Episcopal Health Foundation, found that 1 in 5 Texans said they're very unlikely to get the vaccine, and only 37% said that they're very likely to get it when it becomes available. This vaccine hesitancy has been declining since September, which is good news, but it's still far too many people who are hesitant and maybe unlikely to get the vaccine. And groups that are the most hesitant are those with lower incomes, less education, younger adults who we know are also more likely to pass the virus through asymptomatic transmission. And as Dr. Bob pointed out, those without health insurance. Those with health insurance, around 38% said they're very likely to get it. Those without health insurance, it's more around 28%. So big gaps there. We took the survey data, which was statewide data from the Episcopal Health Foundation, and looked at the age and income differences and applied those to the age and income profiles of counties throughout the state. And here are the results of that, looking at the percent who are very likely to take the vaccine. Again, these are estimates. For Harris County is 37%, similar to the state. It's a bit higher in some of the surrounding counties in the Houston region. Fort Bend at 39, Montgomery at 39%, Galveston and Brazoria at 38%, in part due to the older age profiles and higher incomes of those counties. But regardless, there's a lot of work to do in the Houston region and across the state to make people feel more comfortable about getting this vaccine. I updated some numbers as of yesterday. Nearly 5% of Texans have received at least one dose of the vaccine. And this varies across counties as well. From Galveston, 7% of people age 16 have had at least one dose, to 5% in Harris County, or up close to 5% in Harris County, but 3% in Montgomery County. And so what we need, as we've been saying, is a data-informed campaign. So we need to use data to track the scope of the challenges we face. So know where messages need to go, and which communities are more hesitant, because many communities are going to be coming along as this vaccine progresses, and they know more people in their community who have received the vaccine and are okay. We saw, for instance, between September and December, the Episcopal Health Foundation found that Black Texans are more likely to be accepting of the vaccine than they were in December than they were in September. And we need to use data to inform vaccine messaging to reach these hesitant groups. We can also use data at the local level to identify trusted community voices who can deliver these messages. So churches, local clinics, places that people trust and know, and voices that they trust. We can also use data to ensure an equitable rollout of the vaccine, to ensure that the people who have been affected, the communities that have been affected hardest by it, are also getting the vaccine, and that they had easy access to the vaccine. And we can also use data, finally, to evaluate the effectiveness of our outreach efforts, so that along the way, we can, if we're heading in the wrong direction, can change course and know that we're reaching the right people as quickly as possible. Finally, I just want to say that the state has done a lot to make this data publicly available and accessible through many of their COVID websites, but more can be done at the community level to ensure that everyone has access to the vaccine. Thanks.
Thank you, David, very much. Next up, let's talk to our favorite pediatrician. Dr. Claire Bikini is a pediatrician and infectious disease specialist with Texas Children's Hospital. Dr. Bikini, what are you seeing?
Thank you for having me today, Bob. And as we know, COVID-19 is a terrible infectious disease. And while children in general have a much more mild disease compared with adults, we're still seeing the impact in kids quite significantly. We've had over 500 children hospitalized in the intensive care unit in our state, and we've had at least 35 pediatric deaths due to this infection. Not to mention all of the other issues that kids are facing due to this pandemic, the skyrocketing mental health needs, food insecurity, suboptimal schooling, et cetera. So this is a big deal to kids. And as Texas is in the midst of the worst surge that we've had since this pandemic started, many of my friends and colleagues in healthcare are feeling, extremely overwhelmed by seeing the extent of disease we're seeing in our patients. But we have, so much hope, and the hope is due to these vaccines. We really believe that this is going to be our last big surge, and that these vaccines can be used to help, provide herd immunity and help us, not see this level of lives lost and lives impacted by this pandemic going forward. But it's going to be essential that all eligible members of our community have the opportunity to learn about these vaccines, to feel comfortable accepting these vaccines, and to get vaccinated. Both the vaccines that we currently have, as you've heard from others, are safe and they're extremely effective. I think it's important to note that, because some of the things that I've heard about the vaccine is that, they were rushed too quickly. But it is important to note that these vaccines were actually studied with the same scientific rigor that we have studied other vaccines. Yes, the trials went incredibly quickly, but that's because we invested a lot of money, and we had a number of people in the public who wanted to volunteer for the studies, because this is such a significant virus and its impact on our communities. We know that 90 to 95% of all vaccine adverse events or complications from vaccines happen after the first 2 months of receiving the vaccine. And we've now had both of these vaccines studied for at least 2 to 6 months. So we know these vaccines are safe. And in addition, we know that these vaccines are 95% protective against COVID-19 disease in general. And as Allison pointed out, they're almost completely protective for having severe disease and dying from this disease. I was asked to mention, at least I think it's important to be completely transparent. These vaccines do have side effects. You know, the most common side effects are sore arm, fever, fatigue, muscle aches, joint pains. I definitely had a sore arm and extreme fatigue for 2 days after both of my doses. But, and actually up to about a third to people can actually need to stay home from work for a day after getting the vaccines. But this is not the vaccine causing you to get COVID. This is your immune system learning, you know, to protect you against this infectious disease. And so again, we know that these vaccines are safe. Another thing that you've heard about in the news is that you can have extremely rarely allergic reactions to these vaccines. These allergic reactions, again, are extremely rare and they're also very treatable. And so it's important for us when we're giving vaccines to monitor patients, but the allergic reactions should not be a reason not to get the vaccine because, again, they're very rare. And when they happen, we can treat people and help them. I do think it's really important to acknowledge that, you know, these are life-saving vaccines and that it's so important to get everybody vaccinated. And I don't want to completely say that Texas has done a bad job. We've actually given more vaccines than any other state in the country. We have to really thank our state health department and the public health officials for trying something that's very chaotic and it's been extremely challenging. And again, we're doing better than most states across the country. We're in the top 10 states in percent of vaccines administered of those vaccines that were received. We've really tried to get the vaccine out there. But again, we have a lot of work to do to improve our vaccine distribution. And it's so important that we do this equitably. I personally have seen, and we have data to suggest that there are many people who are facing a lot of barriers to getting the vaccine. People living in rural communities, people who don't have access reliably to the internet where, you know, people are signing up for the vaccine. In addition, problems with reliable transportation. Totally agree with what Allison said about our state immunization registry. We know it needs to be improved. So I do believe that as part of this effort and as our state, we can actually overcome these barriers. And I just want to emphasize how much I believe that getting the adults vaccinated will make a huge impact in the lives of our children here in Texas. Kids are getting the vaccine getting the virus from adults. Once we vaccinate adults, the kids are going to have less disease. And I also believe that kids are going to have so much, improved mental health and improved outcomes in general, just by getting this number of viruses, the virus transmission down in our community. I just want to emphasize how extremely hopeful I am that these vaccines are going to be the answer for our community. And so I'm just really happy to be part of this collaborative to try to improve the uptake of vaccines and the distribution of the vaccines in our state, just because it's so important that we use these vaccines to stop the spread of this virus.
Thank you very much, Dr. McKinney. Dr. James McCarthy is the Chief Physician Executive at Memorial Hermann. Dr. McCarthy, thanks for being here today.
So thank you very much. A pleasure to be here. And I agree with everything that's been said already, and I'm not going to belabor some of these important points that have been made. I'd like to take us a slightly different direction and go down one or two things that I think are important in understanding where we are. So first of all, let's recognize the greater Houston area had a major healthcare disparities problem before this started. We have areas of tremendous food insecurity. We have the largest uninsured rate in large metropolitan areas in the United States, and a huge portion of our community that does not have regular, consistent access to healthcare. The pandemic has worsened all of that. It has enhanced inequities in healthcare distribution. The socioeconomic impact and job losses has disproportionately impacted low-income workers, especially in our community, and compounded the number of uninsured that we have. Compound that with public transportation challenges, challenge of the ability to unable to work remotely for many communities, and we have exacerbated all the healthcare disparities that we have known were a problem for a long time. Getting vaccine to these communities is another unique challenge. These communities often are heavily Black and brown, and as a percentage of population, they have suffered a larger burden of disease during this pandemic and are at particular risk. Engaging these communities, though, there's one mentioned earlier about internet access, is a real challenge. This is not a vaccine distribution with the currently available vaccines. We can drive in with vans, hit a community center, vaccinate everybody that shows up and move on. We have to log everybody. We have to be sure that we can access them. We have a moral responsibility to ensure we can get them that second dose, or at least make a very good faith on getting them that second dose, which is critical to set up And we don't have an infrastructure set up in large scale to do that. To put one number into perspective, the greater Houston metropolitan area, about 7 million people, over 800,000 are over the age of 65. They're in group 1B. That doesn't even get to the group that is with a medical comorbid disease from 16 and over. So a massive portion of our population believes they are eligible for vaccine now, and we simply do not have enough supply to do that. One of the things that we're facing on the healthcare delivery side right now is this tremendous frustration from people who believe, I'm in 1B, why can't I sign up? And the simple matter for that, the fact of the matter is we do not have adequate supply to do that. Memorial Hermann's given out in excess of, I think we're in excess of 44,000 vaccine doses after our NRG event over the last weekend. There's a tremendous amount that we've pushed out already. It's just a drop in the bucket. And this is a time where, especially folks who have insurance are used to being able to sign up and get what they want for their healthcare immediately. We don't have capacity for it. One of the real challenges for us to understand, and we need help from the state and from the federal government, is to understand how supply chain will go, because I can't build a distribution plan with inconsistent supply. I set out a distribution plan, I've got ready to give the shots, and I've got no vaccine to give. I will be out in the next 7 days, run out of our current supply, and I have people scheduled 2 weeks from now that I'm anticipating resupply but don't yet have. So until we have a steady, consistent supply at the state level to the region area, for us to build a robust infrastructure is just going to take some time. And one of the things that's tremendously frustrating is I don't want to sign people up for 2 weeks from now when I don't know if I'll have dose to give them, because canceling someone's appointment is perhaps even more frustrating than not being able to make one in the first place. But we're all working through that. There's some tremendous cooperations happening between public and private partnerships, tremendous cooperation with the state. We're pleased to announce that, or to continue the announcement, we've been identified a hub, so we will be part of the regional solution. I do want to make one important point about that, that all of us who are receiving allocation, that is not our allocation. We are being given allocation by the state to help distribute that at a local level. So we are not reserving this for a small, close club community. We're trying to push this out into our underserved communities. We're exploring texting solutions. We're going to need other solutions for people who are further out on the technology access, for them to be able to access us, to sign up, working with community centers, working with our neighborhood clinics to figure out how to push vaccine out. And it is going to take the entire community. You said something earlier, Bob, at the beginning, it's going to take a year. That's absolutely right. If we were to start vaccinating in Houston, 50,000 people per day, we won't be done with the 80% of herd immunity we want to get to till the end of September, right? This is going to take months. And one of the things I would really reinforce is that we need the public, we need our healthcare providers to be patient while we roll these plans out. There's not enough vaccine for us to give to everybody anyway right now. They're going to feel, some people who feel they were, it's not fair, they didn't get to sign up today. You're going to get to sign up. We're going to get everybody signed up. That is our obligation to our community. If I don't get the whole community healthy, my family can't be healthy. So we've got to get everybody vaccinated so we're all taken care of. But it will take us months to work methodically through our community to do. And it will only be with cross collaboration with multiple interested parties will we get it done efficiently and equitably for the region. Thank you.
Dr. McCarthy from Memorial Hermann, thank you very, very much. Colleen Dipple is the CEO over at Families Empowered, working with families all across the state of Texas. Colleen, what's your take on everything that's happening right now around the vaccine?
Yeah, thanks for including me. It's really an honor to be with these incredible physicians and folks who've been on the front lines. I just want to thank them. And, we're in the business of serving families, thousands of families across the state. And we hear from them all the time. And we're hearing two things. They're really concerned about learning loss. And Dr. Keeney pointed this out. They're concerned about all kinds of services their kids aren't getting that they usually get in school, right? Mental health services, special education services, and other things. But they're also really concerned about safety, right? So we know enrollments are down. We know that our most vulnerable families are reluctant to go back to school. And so we're embarking on a re-enroll Texas campaign because we know kids really need to be back in school. But that starts with vaccinations, right? That starts with our population getting vaccinated because we need to protect our teachers. We need to protect our bus drivers, our ancillary staff, our custodians, our parents, the grandparents. in our kids. And the best way to protect our kids is if every eligible adult and every eligible young adult gets this vaccine. And so we are really committed to working with our community health partners, with Texas Children's and Legacy Health and others who, Bob, you all at Children at Risk have brought together, so that our schools are protected and that our families have good information. What we're excited about, many of our families are under-resourced, right? They're vulnerable populations. And this vaccine is being made available to everyone, to every Texan, regardless of income. And that is just a message that we are sharing through our bilingual call center. We usually work in the business of helping families find schools for free, but we are really committed to supporting this messaging campaign so that our families get protected, so that they can protect the school workers who do great work with our kids, so we can all get our children back into school next fall. But it's going to take a group effort and really, again, trusted partners reaching out to families and giving them accurate, actionable information. So, we're just thrilled to be a part of this, and want to urge everyone who is eligible to get their vaccines to be patient. And in the meanwhile, wear masks, social distance, and wash your hands. I've learned that message, and I appreciate all the physicians who have just reminded us.
Very good. Thank you all very, very much. Algunas palabras para la prensa latina. Mira, estamos hablando de la vacuna sobre el COVID-19. Mira, estamos preocupados que hay muchas partes de la población que tienen miedo de si la vacuna, pueden usar la vacuna. Especialmente estamos hablando de la población que no tiene seguro de salud, pero también la población inmigrante. Hay muchos que necesitan un mensaje donde pueden saber que es una vacuna gratis, que es una vacuna que no hay riesgo para usted. Y para nosotros queremos que todos tienen este mensaje sobre la vacuna. Hay mucho trabajo y es un trabajo largo para nosotros. Sabemos que tenemos un año para hacer eso, pero todos tienen que saber este mensaje. Thank you all very, very much for all that you're doing. And we hope that this message begins to get across the state. And we also hope that public officials and foundations join us in creating a special message, a unique message for those unique populations that do have a little hesitancy around this. Thank you all very much for everything you're doing. That's it.